Parma, mental health. Hospitalizations on the rise, over 100 compulsory mental health treatments, TSO, and HWAR3 suicides per month. Source, Integrated Mental Health Care Department, Pathological Addictions, DAISMDP. Parma Local Health Authority Reference Period, 2024 data, except where indicated. Overview psychiatric hospitalizations, 320 in 2024, plus 14% over 2023. Compulsory mental health treatments, TSO, 106, 101 in 2023. People with at least one day ISMDP treatment, 17,634, 17,081 in 2023. Patients in adult mental health centers, CSM, 5,271, was 1.4% of adults, 57% women. Suicides, 35 in 2024, 3-month, 25 men. In 2023, there were 33. Readmission rate 8 to 30 days, LEA, 2.95%, 16 out of 542 admissions, well below the national standard of 6.9%. Inpatient psychiatric consultations, 2,705, 2,521 in 2023, 1,780 emergency departments, 925 wards, 95 on minors, 65 in 2023. What the services say? Director Pietro Pellegrini reports, constant growth in contacts with mental health centers, probably 9.6% already between 2022 and 2023, from 7,843 to 8,599, further increase in 2024. Youth suffering, not widespread but growing. Post-COVID, socioeconomic insecurity, a climate of anxiety and global uncertainty impact mood, sleep, and relationships. Families and loneliness. 40% of households are single-person households. Over 65s account for over 25%, compared to 12% in the 1980s. Loneliness correlates with depression and cognitive decline. Eating disorders. A lighthouse house, specialty daycare, has been planned. In 2023, the emergency room will receive 448 admissions for eating disorders, 28% minors, 40% 18 to 34-year-olds. Up from 330 in 2021. Increase in compulsory medical treatment compared to pre-COVID, growing demand for eating disorders and autism spectrum disorders. Main diagnoses, SMA 2024, schizophrenia and related disorders, 24.5%, bipolar disorder, 17.1%, personality disorders, 14% eating disorders, 94% female prevalence, depressive disorders, 66.7% female substance use disorders, 68% male average age at diagnosis, lower, 25 years, for eating behavioral disorders, higher, 53 years, for organic, bipolar, and depressive disorders. Citizenship and access. Foreign nationals with access to services, 2024, 3,219, 18% versus 19% in 2023, 61% men, average age, 23, Italians, 37. Distribution by area, NPIA, childhood adolescent neuropsychiatry, 28%, SMA, 11%, DP, addiction, 18%. Substance use disorders and behavioral emotional disorders are relatively more frequent among foreigners. Suicides, 35 cases in 2024 in Parma, male predominance. Among patients followed by DAISMDP, 4 deaths by suicide in 2024, 10-year average, 3.5. Multifactorial phenomenon, biological, psychological, relational, social, economic, cultural, not reducible to the presence of mental disorders alone. Services and organization. Increase in admissions also to SPOI, intensive psychiatric hospital facilities, including those affiliated with the National Institute of Mental Health. Mechanical restraints in SPDC. 7 throughout the year, each with an audit, objective, no restraint model with training and TSO prevention. Central role of GPs and PLS in identifying comorbidities and chronic conditions, launch of the family and community nurse to strengthen home care. Contextual factors. Pellegrini links the increased demand and personal instability to post-pandemic, growing poverty and inequality, international and climate crises, migration, housing, and job insecurity. In schools, increased burden due to disabilities, special educational needs, emerging substance use, self-harm, and social withdrawal. What this means for the community, in brief, growing demand for mental health, adults and youth. Gender gap in diagnoses, more depression EDs among women, more substances among men. Age and citizenship influence clinical profiles and access. Personalized and culturally competent pathways are needed. Good quality indicators, readmissions, but pressure on hospitalizations, compulsory medical treatment, and emergency departments. What to do? Practical guidelines. Prevention and proximity. Strengthen mental health centers, CSM, NPIA, counseling centers, and school health care. Strengthen IFEC, institutional health and care centers, and home care. Social and health integration. Coordinate social services, employment, housing, and associations. Anti-loneliness programs for the elderly and people living alone. Focus on young people. Prevention of eating disorders, substances, and self-harm, withdrawal through school help desks, family counseling, and rapid response times. Reduction of compulsory medical treatment, TSO, no restraint, ongoing training, de-escalation, and dedicated therapeutic spaces. Data and quality, monitoring outcomes, readmissions, and waiting times. Audits of critical events, transparent public communication.